Dear students, the topic of lecture is physiological basis of psychical functions and work activity. All areas of the cerebral cortex have extensive efferent and afferent connections with deeper structures of the brain. It is important to emphasize the relation between the cerebral cortex and the thalamus. When the thalamus is damaged, along with the cortex, the loss of cerebral function is far greater than when the cortex alone is damaged, because thalamic excitation of the cortex is necessary for almost all cortical function. In the picture, you can see the areas of the cerebral cortex that connected with specific parts of the thalamus. These connections act in two directions, both from the thalamus to the cortex and then from the cortex to essentially the same area of the thalamus. When the thalamic connections are cut, the functions of the corresponding cortical area become almost entirely lost. Therefore, the cortex operates in close association with the thalamus and can almost be considered both anatomically and functionally a unit with the thalamus. Almost all pathways from the sensory receptors and sensory organs to the cortex pass through the thalamus, with the principal exception of some sensory pathways of the olfaction only. The map of some of the functions of different cerebral cortical areas was determined from electrical stimulation of the cortex in awake patients or during neurological examination of patients after portions of their cortex had been removed. The electrically stimulated patients told their thoughts evoked by the stimulation, and sometimes they experienced movements. Occasionally, they spontaneously emitted a sound or even a word, or gave some other evidence of the stimulation. The slide shows several large areas of the cerebral cortex that do not fit into the rigid categories of primary and secondary motor and sensory areas. These areas are called association areas because they receive and analyze signals simultaneously from multiple regions of both the motor and sensory cortices, as well as from subcortical structures. Yet, even the association areas have their specializations. Important association areas include, first of all, the parieto-occipital association area, also the prefrontal association area, and at third, the limbic association area. According to Pavlov, the higher nervous activity of animals, even those at high level of development, for example, dogs and monkeys, is on the whole a result of complexity of diverse conditioned reflexes of the first signaling system, which is common both to man and to animals. In spite of the gradual development of speech, the conditioned reflexes of the first signaling system still continue to constitute the basic fund in the higher nervous activity of children in the first years of life and occupy a specific place in the higher nervous activity of humans at subsequent stages of growth. To this type of conditioned reflex activity, Pavlov attributes sensations, ideas, and impressions acquired by humans from the external environment, including the social environment, which are formed without the use of verbal signals. But in the case of human, along with the development of social forms of wake activity, there is the second signaling system of reality. So the world around us we perceive thanks to two systems of analyzing signals, the first and second signaling systems. To obtain information about the state of the body and the external environment, the first signaling system uses all the sensory organs of humans like touch senses, sight, smell, hearing, taste. A second, younger signal system allows us to perceive the world through speech. Its development occurs on the basis and in interaction with the first in the process of development and growth of human. The first human signaling system functions in the same way as in higher animals. Its separate functioning is observed only in newborns, from birth to the age of 6 months maybe, if the child is in a normal social environment. Formation and development of the second signaling system is accomplished in the process and as a result of upbringing and education when child develops in social environment in the process of interaction between people. As a result of social development and the mastering of speech, the second signaling system arises and evolves. We mark by words the signals which we meet in surrounding environment, which we feel as changes of inner environment. So our words, our language, this is secondary signals which are encoding the primary signals originated from outside or inside in our body. As the child psychic life develops, the ability to understand and then to reproduce speech is gradually developed as a consequence of the emergence and consolidation of associative connection, pronounced sounds or words with sensory impressions about the objects of the external environments develop gradually. In the first signaling system, both means and methods of communication and all other forms of behavior are based on the direct perception of the surrounding reality and the reaction to impulses coming from it in the process of interaction. The first signaling system of a human is a reciprocal, concrete sensory reflection of the impact on receptors from the outside world. Initially, in the body, there is a sensation of any phenomena, properties, or objects perceived by the receptors or any other senses. Then the sensations are transformed into more complex forms, perceptions. And only after the second signaling system is formed and developed, it becomes possible to create abstract forms of reflection that are not attached to a particular object, such as representation and concepts. For the normal functioning of both signal systems, the centers located in the cerebral hemispheres are responsible. Reception and processing of information for the first signal system is performed by the right hemisphere. Both the perception and processing of the information flow for the second signal system, produces the left hemisphere, which is responsible for the development of logical thinking. The second human signaling system depends on the structural integrity of the brain and its functioning. The first and second signaling systems, according to Pavlov, are in constant interaction and are interconnected in terms of the functions performed. This is due to the fact that on the basis of the first arise and develop a second signaling system. The signals of the first coming from the environment and from different parts of the body are in continuous interaction with the signal of the second signaling system. During such interaction occurs the emergence of conditioned reflexes of a higher order, which create functional connections between them. In connection with the development through processes and the social way of life, the second signaling system is more developed in human. In the process of individual mental development of a child born on time, the first signal system begins to take shape within a few days after birth. At the age of 7 to 10 days, the formation of the first conditioned reflexes is possible. So baby makes sucking movement with his lips even before he or she puts a nipple in his mouth. Conditional reflexes to sound stimuli can form at the beginning of the second month of life. The older the child becomes, the faster conditioned reflexes are formed in his organism. In order for the monthly infant to have a temporary connection, many repetitions of the effect of unconditioned and conditioned stimuli will have to be done. A 2-3 months old child will need only a few repetitions to create the same temporary connection in the brain compared to the previous period of life. Thus, in the course of the child's psychological development, along the childhood and adolescence, there is a change in the significance and property of the signaling systems. At a school age and until the commencement of puberty, the second signaling system is brought to the fore. During puberty, due to significant hormonal and physiological changes in the body of adolescents, for a short period, the first signaling system again becomes very important for them. To the senior classes of the secondary school, the second signaling system again develops in greater demand and keeps the main position throughout all life, constantly being improved and developing. The first signaling system of people, despite the predominance of adults in the second, it is of great importance in such types of human activity as sport competition, creativity, learning, work activity. And without first signaling system, actually we could not imagine the creation of music and variable arts, acting, professional interaction, variable kind of activity, also lifelong require action of the first signaling system as well as second signaling system. Despite the similarity of these systems in humans and animals, in humans the first signaling system is a much more complex and perfect structure comparing to physiology of animals. Nowadays, it is known the special areas in the cerebral cortex which are responsible for language function. And first of all, this is sensory speech area or so-called Wernicke's area for language comprehension. The major area for language comprehension, called Wernicke's area, lays behind the primary auditory cortex in the posterior part of the superior gyrus or the temporal lobe. You can see actually location of these areas, variable speech areas, in the slide. We discuss this area corresponding to the ability of human to perceive language based on variable kinds of sensory stimulation. Put attention, please, that Wernicke's area is located between the associative visual area, associative auditory, and associative somatic sensory areas. And because of that, we have methods of conduction information by view. So we have reading function. By hearing, we can understand spoken language. And there is also opportunity for blind people to learn language using Braille alphabet, which engages tactile sensation in language education. There is also angular gyrus area, which is needed for initial processing of visual language information, that is reading. Posterior to the language comprehension area, laying mainly in the anterolateral region of the occipital lobe, it is a visual association area that feeds visual information conveyed by words read from a book into Wernicke's area, the language comprehension area. This angular gyrus area is needed to make meaning out of the visually perceived words. In its absence, a person can still have excellent language comprehension through hearing, but not through reading. Injury of the angular gyrus can result in agraphia, inability to write. With alexia, inability to read, a condition in which a person cannot read, write, and spell words. There is also special area for naming objects. In the most lateral portions of the anterior occipital lobe and posterior temporal lobe is an area for naming objects. The names are learned mainly through auditory input, whereas the physical natures of the objects are learned mainly through visual input. In turn, their names are essential for both auditory and visual language comprehension, which corresponds to functions performed in Wernicke's area, located immediately superior to the auditory names region and anterior to the visual word processing area. The prefrontal association area functions in close association with the motor cortex to plan complex patterns and sequences of motor movements. To aid in this function, it receives strong input through a massive subcortical bundle of nerve fibers connecting the parieto-occipito-temporal association area with the prefrontal association area. Through this bundle, the prefrontal cortex receives much pre-analyzed sensory information, especially information on the spatial coordinates of the body that is necessary for planning effective movements. Much of the output from the prefrontal area into the motor control system passes through the caudate portion of the basal ganglia, which is thalamic feedback circuit for motor planning, which actually provides mainly of the sequential and parallel components of movement stimulation. The prefrontal association area is also essential to carrying out thought process. This characteristic presumably results from some of the same capability of the prefrontal cortex that allow it to plan motor activities. It seems to be capable of processing non-motor and motor information from widespread areas of the brain and therefore to achieve non-motor types of thinking as well as motor types. In fact, the prefrontal association area is frequently described simply as important for elaboration of thoughts, and it is said to store on a short-term basis waking memories that are used to combine new thoughts while they are entering the brain. There is also area that provides the neural circuitry for word formation, named by Broca. Broca's area is located partly in the posterior lateral prefrontal cortex and partly in the premotor area. It is here that plans and motor patterns for expressing individual words or even short phrases are initiated and executed. This area also works in close association with the Wernicke language comprehension center in the temporal association cortex. When a person has already learned one language and then learns a new language, the area in the brain where the new language is stored is slightly removed from the storage area for the first language. If both languages are learned simultaneously, they are stored together in the same area of the brain. There is also very important limbic association area, which is found in the anterior pole of the temporal lobe, in the ventral portion of the frontal lobe, and in the cingulate gyrus lying deep in the longitudinal fissure on the mid-surface of each cerebral hemisphere. It is concerned primarily with behavior, emotions, and motivation. The limbic cortex is a part of much more extensive system, the limbic system, that includes a complex set of neuronal structures in the mid-basal regions of the brain. This limbic system provides most of the emotional drives for activating other areas of the brain and even provides a motivational drive for the process of learning itself. There is special area for recognition phases, which is located also in the basis of the brain, as you can see in the slide. An interesting type of brain abnormality called prosopagnosia is the inability to recognize phases. Actually, from notion about this pathology was discovered this area in the cerebral cortex. This condition occurs in people who have extensive damage on the medial undersides of both occipital lobes and along the medioventral surfaces or the temporal lobes. Loss of these phase recognition areas, strangely enough, results in little other abnormality of brain function. One may wonder why so much of the cerebral cortex should be reserved for the simple task of face recognition. However, most of our daily tasks involve association with other people, and thus one can see the importance of this intellectual function. The occipital portion of this facial recognition area is continuous with the visual cortex, and the temporal portion is closely associated with the limbic system that has to do with emotions, the brain activation, and control of one's behavioral response to the environment. The Wernicke's area has also interpretive function. The somatic, visual, and auditory association areas will meet one another in the posterior part of the superior temporal lobe, shown in the picture, where the temporal, parietal, and occipital lobes all come together. This area of confluence of the different sensory interpretative areas is especially highly developed in the dominant side of the brain. The left side is almost all right-handed people, and it plays the greatest single role of any part of the cerebral cortex for the higher comprehension levels of brain function that we call intelligence. Therefore, this region has been called by different names, suggestive on an area that has almost global importance. The general interpretative area, the gnostic area, the knowledge area. It is also named the tertiary association area. It is best known as Wernicke's area in honor of the neurologist who first described its special significance of these intellectual processes. After severe damage in Wernicke's area, a person might hear perfectly well and even recognize different words, but still be unable to arrange these words into a coherent thought. Likewise, the person may be able to read words from the printed page, but be unable to recognize the thought that it conveyed. Electrical stimulation of Wernicke's area in a conscious person occasionally causes a highly complex thought, particularly when the stimulation electrode is passed deep enough into the brain to approach the corresponding connecting areas of the thalamus. The types of thoughts that might be experienced include complicated visual scenes that one might remember from childhood, auditory hallucinations such as specific musical piece or even statement made by a specific person. For this reason, it is believed that activation of Wernicke's area can call forth complicated memory patterns that involve more than one sensory modality, even though most of the individual memories may be stored elsewhere. This belief is in accordance with the importance of Wernicke's area in interpreting the complicated meanings of different patterns of sensory experience. The angular gyrus is important for interpreting of visual information. The angular gyrus is the most inferior portion of the posterior parietal lobe, laying immediately behind Wernicke's area and fusing posteriorly into the visual areas of the occipital lobe as well. If this region is destroyed, while Wernicke's area in the temporal lobe is still intact, the person can still interpret auditory experiences as usual, but the stream of visual experiences passing into Wernicke's area from the visual cortex is mainly blocked. Therefore, the person may be able to see words and even know what they are words, but may not be able to interpret their meanings. This condition is called alexia or word blindness. The term dyslexia is used to describe difficulty in learning about written language, not complete word blindness. Nowadays, based on a study of clinical cases with people who had damage of one hemisphere, was formulated the concept of the dominant hemisphere. The general interpretative functions of Wernicke's area and the angular gyrus, as well as the functions of the speech and motor control areas, are usually much more highly developed in the people who has privation of one cerebral hemisphere comparing to the other. Therefore, this hemisphere is called the dominant hemisphere. In about 95% of all people, the left hemisphere is the dominant one. Even at birth, the area of the cortex that will eventually become Wernicke's area is as much as 50% larger in the left hemisphere than in the right, in more than one half of neonates. Therefore, it is easy to understand why the left side of the brain might become dominant over the right side. However, if for some reason this left side area is damaged or removed in very early childhood, the opposite side of the brain will usually develop dominant characteristics. The following theory can explain the capability of one hemisphere to dominate the other hemisphere. The attention of the mind seems to be directed to one principal thought at a time. Presumably because the left posterior temporal lobe at birth is usually slightly larger than the right lobe, the left side normally begins to be used to a greater extent than is the right side. Therefore, because of the tendency to direct one's attention to the better developed region, the rate of learning in the cerebral hemisphere that gains the first start increases rapidly, whereas in the opposite, less used side, learning remains less well developed. Therefore, the left side normally becomes dominant over the right side. In about 90% of all people, the left temporal lobe and angular gyrus become dominant, and in the remaining 5%, either both sides develop simultaneously to have dual function, or more rarely, the right side alone becomes highly developed with full dominance. As discussed in the modern literature, the premotor speech area, which is Broca's area, located far laterally in the intermediate frontal lobe, is also almost always dominant on the left side of the brain. This speech area is responsible for formation of words by exciting simultaneously the laryngeal muscles, respiratory muscles, and muscles of the mouth. The motor area for controlling hands are also dominant in the left side of the brain in about 90% of persons, thus causing right-handed gests in most people. Although the interpretative area of the temporal lobe and angular gyrus, as well as many of the motor areas, are usually highly developed in only the left hemisphere, these areas receive sensory information from both hemispheres and are also capable of controlling motor activities in both hemispheres. For this purpose, they use mainly fiber pathways in the corpus callosum for communication between the two hemispheres. This unitary, cross-feeding organization prevents interference between the two sides of the brain. Such interference could create havoc, which both mental thought and motor responses. The language plays a very important role in the functioning of Wernicke's area and also intellectual functions of the human. A major share of our sensory experience is converted into its language equivalent before being stored in the memory areas of the brain. That is actually a process of encoding of primary signals into secondary signal system. And before this is done, before being processed for other intellectual purposes. For example, when we read a book, we don't store the visual images of the printed words, but instead store the words themselves of their conveyed thoughts, often in a language form. The sensory area of the dominant hemisphere for interpretation of language is Wernicke's area, and this area is closely associated with both the primary and secondary hearing areas of the temporal lobe. This close relation probably results from the fact that the first introduction to language is by way of hearing. Later in life, when visual perception of language through the medium of reading develops, the visual information conveyed by written words is then presumably channeled through the angular gyrus, a visual association area, into the already developed Wernicke's language interpretative area of the dominant temporal lobe. When the Wernicke's area in the dominant hemisphere of an adult person is destroyed, the person normally loses almost all intellectual functions associated with language or verbal symbolism, such as the ability to read, ability to perform mathematical operations, and even the ability to think through logical problems. Many other types of interpretative capabilities, some of which use the temporal lobe and angular gyrus regions of the opposite hemispheres, are retained as well. Psychological studies in patients with damage to the non-dominant hemisphere have suggested that this hemisphere may be especially important for understanding and interpreting music, non-verbal visual experiences, especially visual patterns. Spatial relations between the persons and their surroundings also are analyzed there, and this area is important for significance of body language and intonations of people's voices, and probably many somatic experiences related to use of the limbs and hands as well. Thus, even though we speak of the dominant hemisphere, this dominance is primarily for language-based intellectual functions only. The so-called non-dominant hemisphere might actually be dominant for some other type of intelligence, like an nonverbal thinking, nonverbal body language, and so on. For years, it has been thought that the prefrontal cortex is the locus of higher intelligence in the human being, principally because the main difference between the brains of monkeys and brains of human beings in the great prominence of the human prefrontal areas. Yet efforts to show that the prefrontal cortex is more important in higher intellectual functions than other portions of the brain have not been successful. Indeed, destruction of the language comprehension area in the posterior superior temporal lobe, that is Wernicke's area, and the adjacent angular gyrus region in the dominant hemisphere causes much more harm to the intellect than does destruction of the prefrontal areas. The prefrontal areas do, however, have less definable but important intellectual functions of their own. Patients with damage to the prefrontal cortex may have normal motor functions and may even perform normally on some intelligence tests. However, they are unable to function effectively in normal daily life. These functions can be explained by describing what happens to the patients in whom the prefrontal areas have become damaged as follows. Several decades ago, before the advent of modern drugs for treating psychiatric conditions, it was discovered that some patients could receive significant relief from severe psychotic depression by severing the neuronal connections between the prefrontal areas of the brain and the remainder of the brain by procedure called prefrontal lobotomy. This procedure was performed by inserting a blunt, thin-bladed knife through a small opening in the lateral frontal skull on each side of the head and slicing the brain at the back edge of the prefrontal lobes from top to the bottom. Subsequent studies in this patient shows the following mental changes. The patient lost the ability to solve complex problems. They became unable to string together sequential tasks to reach complex goals. They also became unable to learn to do several parallel tasks at the same time. Their level of aggressiveness decreased, sometimes markedly, and they often lost ambition. Their social responses were often inappropriate for the occasion, often including loss of morals and little reticence in relation to sexual activity and excretion. The patients could still talk and comprehend language, but they were unable to carry through any long trains of thought, and their moods changed rapidly from sweetness to rage, exhilaration to madness. The patient could also still perform most of the usual patterns of motor function that they had performed throughout life, but often without purpose. From this information, after analyzing the clinical experience, there was obtained conclusion that coherent understanding of the function of the prefrontal association area may be done based on this data. One more important process which our brain does is elaboration of thought, prognostication, and performance of high intellectual functions due to the activity of prefrontal areas. So this function nowadays is summarized as a concept of a working memory. Another function that has been ascribed to the prefrontal areas is elaboration of thought which means simply an increase in depth and abstractness of the different thoughts put together from multiple sources of information. Psychological tests have shown that prefrontal lobectomized lower animals presented with successive bits of sensory information fatal to keep track of these bits even in temporary memory, probably because they are distracted so easily that they cannot hold thoughts long enough for memory storage to take place. This ability of the prefrontal areas to keep track of many bits of information simultaneously and to cause recall of this information as it is needed for subsequent thoughts is called the brain's working memory, which may explain the many functions of the brain that we associate with higher intelligence. In fact, studies have shown that the prefrontal areas are divided into separate segments for storing different types of temporary memory, such as one area for storing shape and form of an object or a part of the body and another for storing movement. By combining all these temporary bits of working memory, we have the abilities to do the following. First of all, we can prognosticate. We can plan for the future. There is also ability for delay action in response to incoming sensory signals so that the sensory information can be waited until the best course of response is decided. It is possible to consider the consequences of motor actions before they are performed. People can solve complicated mathematical, legal, or philosophical problems. There is also correlation in our mind between all avenues of information in diagnosing rare diseases, and there is also ability to control our activities in accordance with moral law. In the next slide, the picture shows two principal pathways for communication. The upper half of the figure shows the pathway involved in hearing and speaking. This sequence is as follows. At first, reception in the primary auditory area of the sound signals that encode words causes then interpretation of the words in the Wernicke's area. Then at thought there is determination, which is done also in Wernicke's area, of the thoughts and the words to be spoken. Then there is process of transmission of signals from Wernicke's area to Broca's area by way of the acute fasciculus. The next step is activation of the skilled motor programs in Broca's area for control of word formation. And then there is transmission of appropriate signals into the motor cortex to control the speech muscles. The lower part of the figure illustrates the comparable steps in reading and then speaking in response. The initial receptive area for the words is in the primary visual area rather than in the primary auditory area. The information then passes through early stages of interpretation in the angular gyrus region and finally reaches its full level of recognition in Wernicke's area. From here, the sequence is the same as for speaking in response to the spoken word. Fibers in the corpus callosum provide abundant bidirectional neuronal connections between most of the cortical areas of the two cerebral hemispheres, except for the anterior portion of the temporal lobes. These temporal areas, including especially the amygdala, are interconnected by fibers that pass through the anterior commissure. One of the functions of the corpus callosum and the anterior commissure is to make information stored in the cortex of one hemisphere available to corresponding cortical areas of the opposite hemisphere. Memories are stored in the brain by changing the basic sensitivity of the synaptic transmission between neurons as a result of previous neuronal activity. Evidently, you have recognized the picture from Nobel press release of the Eric Kandel's Nobel lecture. And actually here you could understand that the mechanism of creation conditional reflexes actually is very similar to creation memory traces in human brain. The new or facilitated pathways are called actually memory traces. They are important because once the traces are established, they can be selectively activated by the thinking mind to reproduce the memories. Although we often think of memories as being positive recollections of previous thoughts or experiences, probably the greater share of our memories is negative. So the brain has the capability to ignore information that is of no consequence. This capability results from inhibition of the synaptic pathways for this type of information, and the resulting effect is called habituation, which is a type of negative memory. Memories are frequently classified according to the type of information that is stored. One of these classifications divides memory into declarative memory and skill memory. Declarative memory basically means memory of the various details of an integrated thought, such as memory of an important experience that includes memory of the surroundings, the time relationships, causes of the experience, maybe meaning of the experience, and the deductions that were left in person's mind. Skill memory is frequently associated with motor activities of the person's body, such as all the skills developed for hitting a tennis ball, including autonomic memories to sight the ball, calculate the relationship and speed of the ball to rocket, deduce rapidly the motions of the body, the arms, and the rocket required to hit the ball as desired, with all of these skills activated instantly based on previous learning of the game, and then moving on the next stroke of the game while forgetting the details of the previous stroke. Actually, based on this data, you could understand why it is so important for the doctor to master motor professional skills in the time of education, and then beginning of the practice is possible with having all the essential motor skill about using medical equipment. Eric Kandel showed initially that weaker stimuli give rise to a form of short-term memory which lasts from minutes to hours. The mechanism for this short-term memory is that particular ion channels are affected in such a manner that more calcium ions will enter the nerve terminal. This leads to an increased amount of transmitter release at the synapse and thereby to an amplification of the reflex. This change is due to a phosphorylation of certain ion channel proteins that is utilizing the molecular mechanism described by Paul Greengard. A more powerful and long-lasting stimuli will result in a form of long-term memory that can remain for weeks. The strongest stimulus will give rise to increased levels of the messenger molecule cyclic adenosine monophosphate and thereby protein kinase A. These signals will reach the cell nucleus and cause a change in number of proteins in the synapse. The formation of certain proteins will increase while others will decrease. The final result is that the shape of the synapse can increase and thereby create a long-lasting increase of synaptic function. In contrast to short-term memory, long-term memory requires that new proteins are formed. In this synthesis of new proteins is prevented, the long-term memory will be blocked, but not the short-term memory. There is also important notion as synaptic plasticity, which helps to understand the precondition for memory. Eric Kandel thus demonstrated that short-term memory as well as long-term memory in the C-slug is located at the synapse. During the 1990s, he has also carried out studies in mice. He has been able to show that the same time of long-term changes of synaptic functions that can be seen during learning in the C-slug also applies to mammals. The fundamental mechanisms that Eric Kandel has revealed are also applicable to humans. Our memory can be said to be located in the synapses, and changes in synaptic function are central when different types of memories are formed. Even if the road towards an understanding of complex memory functions still is long, the results of Eric Kandel has provided a critical building stone. It is now possible to continue and, for instance, study how complex memory images are stored in our nervous system and how it is possible to recreate the memory of earlier events. Since we now understand important aspects of the cellular and molecular mechanisms which make us remember, the possibilities to develop new types of medication to improve memory function in patients with different types of dementia may be increased. Consolidation of memory. This is the next important step in the memory function. For short-term memory to be converted into long-term memory that can be recalled weeks or years later, it must become consolidated. That is, the short-term memory, if activated repeatedly, will initiate chemical, physical, and anatomical changes in the synapses that are responsible for the long-term time of memory. This process requires 5 to 10 minutes for minimal consolidation and some 1 hour or more for strong consolidation, which requires synthesis of messenger RNA and proteins in the neurons. The word limbic means body, and the limbic system is actually set of structures around the basal regions of the cerebrum. But as we have learned more about the functions of the limbic system, the term limbic system has been expanded to mean the entire neuronal circuits that control emotional behavior and motivational drives. A major part of the limbic system in the hypothalamus with its related structures. In addition to their roles in behavioral control, these areas control mainly internal conditions of the body, such as temperature, osmolarity of the body fluids, and the drives to eat and drink and to control body weight. These internal functions are collectively called vegetative functions of the brain, and their control is closely related to behavior. Subcortical structures of the limbic system surrounding hypothalamus include the septum, paraolfactory area, anterior nucleus of the thalamus, portions of the basal ganglia, hippocampus, amygdala, and surrounding them subcortical limbic areas in the limbic cortex, which compose the ring of cerebral cortex on each side of the brain. This is beginning in the orbitofrontal area of the ventral surface of the frontal lobes, also extending upward into the subcallosal gyrus, and then over the top of the corpus callosum onto the medial aspect of the cerebral hemisphere in the cingulate gyrus, and also passing behind the corpus callosum and downward onto the ventromedial surface of the temporal lobe to the parahippocampal gyrus and uncus. Important route of communication between the limbic system and the brainstem is the medial forebrain bundle, which extends from the septal and orbitofrontal regions of the cerebral cortex downward through the middle of the hypothalamus to the brainstem reticular formation. This bundle carries fibers in both directions and forms a trunk-line communication system. A second route of communication is through short pathways among the reticular formation of the brainstem, thalamus, hypothalamus, and most other contiguous areas of the basal brain. Several limbic structures are particularly concerned with the affective nature of sensation, that is, whether the sensations are pleasant or unpleasant. These affective qualities are also called reward or punishment or satisfaction or aversion centers. And electrical stimulation of certain limbic areas pleases or satisfies the animal. Various electrical stimulation of other regions causes terror, pain, fear, defensive behavior, escape reactions, and all the other elements of punishments. The degrees of stimulation of these two oppositely responding systems greatly affect the behavior of the animal. In addition to the vegetative and endocrine functions of the hypothalamus, stimulation or lesions in the hypothalamus often have profound effects on emotional behavior of animals and human beings. Some of the behavioral effects of stimulation are following. First of all, stimulating in the lateral hypothalamus not only causes thirst and eating, but also increases the general level of activity of the animal, sometimes leading to overt rage and fighting. Stimulation of the ventromedial nucleus and surrounding areas mainly causes effects opposite to those caused by lateral hypothalamus stimulation, that is, a sense of satiety, decreased eating, and tranquility. Stimulation of a thin zone of periventricular nuclei located immediately adjacent to the third ventricle usually leads to fear and punishment reactions. And sexual drive can be stimulated from several areas of the hypothalamus, especially the most anterior and most posterior portions. Effects caused by lesions of hypothalamus in general may be described as the following. First of all, bilateral lesions in the lateral hypothalamus will decrease drinking and eating almost to zero, often leading to lethal starvation. Bilateral lesions of the ventromedial areas of the hypothalamus cause effects that are mainly opposite to those caused by lesions of the lateral hypothalamus, so will be excessive drinking and eating. Stimulation of lesions in other regions of the limbic system, especially in the amygdala, the septal area, and areas in the mesencephalon often cause effects similar to those elicited from the hypothalamus. Emotions are actually aspects of higher nervous activity that characterize subjective attitude of person to various stimuli in surroundings. The limbic association area is found in the anterior pole of the temporal lobe, in the ventral portion of the frontal lobe, and in the cingulate gyrus laying deep in the longitudinal fissure of the mid-surface of each cerebral hemisphere. It is concerned primarily with behavior, emotions, and motivations. Biological theory of emotions considers that a life course includes two main stages of behavioral act. At first, there is forming of needs and motivations that results from negative emotions. And then in second, satisfaction of needs that leads to positive emotions, cause of complete accordance of image and result action. Information theory of emotion considers that emotions reflect power of human need and possibility of its satisfaction in current moment. In absence of needs, emotions will not arise. Emotional excitation is spread in the brain due to a variety of neurotransmitters, which are noradrenaline, acetylcholine, serotonin, dopamine, and neurotransmitters which are neuropeptides, including opiates. Positive emotions may be explained by revealing catecholamines, and negative emotions as aggression result from production acetylcholine in the brain matter. Emotional status reflects actual needs of human and actually helps in its realization. The drive reduction theory expresses the idea that a physiological need creates an aroused state that drives the organism to reduce need by, say, eating or drinking. And according to subjective status, there are positive and negative emotions. Negative emotions are scenic, like aggression or affect, that stimulate human activity, and there are also asthenic emotions as horror, sadness, depression that could inhibit behavior. Lower or elementary emotions are caused by organic needs of human or animals like hunger, thirst, survival, and so on. In humans, even lower emotions undergo their cortical control and require upbringing. In newborn babies, emotions of horror, anger, pleasure are revealed just after birth. Hunger, pain, getting cool, wet, bad clothes causes negative emotions in newborn children with grimace of suffering and crying. Sudden new sound or loss equilibrium causes horror, and loss of free movement causes anger. And final formation of human emotions develops gradually with maturation of the brain and entire organism, and also includes the development of endocrine regulatory systems, and also requires upbringing. Actually, the theory of needs was developed by prominent psychologist Abraham Maslow. He, in 1970s, described these priorities as a hierarchy of needs. You can see the pyramid of needs in the slide. At the base of this pyramid are our physiological needs, such as those for food or water. Only if these needs are met are we prompted to meet our need for safety, and then to satisfy the needs to give and receive love, and then to enjoy self-esteem. And only after satisfaction of primary needs, satisfaction need of safety, the higher needs may develop, which have a relation to social life, and because of that they are named as higher needs. Near the end of his life, Maslow proposed that some people also reach a level of self-transcendence. At this level, he decided people seek to realize their own potential. At the self-transcendence level, people strive for meaning, purpose, and communion that is beyond the self, that is transpersonal already, and these people start to care about society. The physiological aim of drive reduction is homeostasis, which is the maintenance of a steady internal state. An example of homeostasis, which is literally staying in the same condition, is the body's temperature regulation system, which works like a room thermostat. And you have studied that in other topics, so may revise from there. Not only are we pushed by our need to reduce drives, we also are pulled by incentives. Positive or negative stimuli, they repel us. This is one way our individual learning histories influence our motives. Human motivation aims not to eliminate arousal, but to seek optimum levels of arousal. This is the result of modern psychology. This theory is the result of modern psychological research. Having all our biological needs satisfied, we feel driven to experience stimulation, and we hunger for information. And reticular excitatory area of the brain stem, this is important driver of brain activity. A general system for controlling the activity level of the brain has the central driving component, which is an excitatory area located in the reticular substance of the pons and mesencephalon, and this area also is called the bulboreticular fascillatory area. It is the same brainstem reticular area that transmit fascillatory signals downward to the spinal cord to maintain tone in the anti-gravity muscles and to control levels of activity of the spinal cord reflexes. In addition to those downward signals, this area also sends a profusion of signals in the upward directions. Most of these signals go first to the thalamus, where they excite a different set of neurons that transmit nerve signals to all regions of the cerebral cortex as well as to multiple subcortical areas. The signals passing through the thalamus are of two types. One type is rapidly transmitted action potential that excites the cerebrum for only a few milliseconds. These signals originate from large neuronal cells bodies that lay throughout the brainstem reticular area. These nerve endings release the neurotransmitter acetylcholine, which serves as an excitatory agent that lasts for only a few milliseconds before off small neurons spread throughout the brainstem reticular excitatory area. Again, most of these signals pass to the thalamus, but through small, slowly conducting fibers that synapse mainly in the intralaminar nuclei of the thalamus and in the reticular nuclei over the surface of the thalamus. From here, additional small fibers are distributed throughout the cerebral cortex. The excitatory effect caused by this system of fibers can build up progressively for many seconds to a minute or more, which suggests that its signals are especially important for controlling the longer-term background excitability level of the brain. Consciousness can perhaps be described as our continuing stream of awareness of either our surrounding or our sequential thoughts. Consciousness, through enabling us to exert voluntary control and communicate our mental status to others, is but the tip of the information processing iceberg. Beneath the surface, unconscious information processing occurs simultaneously of many parallel tracks. Serial conscious processing through slower than parallel processing is skilled at solving new problems which require our focused attention. Specific stimulated areas of the cerebral cortex determine discrete characteristics of our thoughts, and these are specific localization of sensations on the surface of the body and objects in the fields of vision, the feeling of the texture of substance like silk or wood, visual recognition of the rectangular pattern of a concrete block wall, other individual characteristics that aid into one's overall awareness of a particular instant. The neurons of the suprachiasmatic nucleus serve for the pacemaker function that is critical for organizing sleep into a recurrent 24-hour circadian patterns of sleeping and waking. And the lesions of the suprachiasmatic nucleus cause many physiological and behavioral disturbances, including loss of the circadian sleep and wake rhythms, Thus, the suprachiasmatic nucleus directs daily cycle of our physiology and behavior that set the tempo of our lives. These parts of the brain, it is described in literature as biological clock. Once the suprachiasmatic nucleus clock has established its circadian rhythm, this information is transmitted to other brain regions through action potentials and to various organs and tissues via nervous and hormonal signals. Axons from the suprachiasmatic nucleus project to other regions of the hypothalamus that are especially important for circadian variations in variable physiological functions as body temperature, the sleep and wake cycle, various hormonal changes, changes in our physical activity, and so on. The suprachiasmatic nucleus receives neural input from specialized, intrinsically photosensitive retinal ganglion cells that contain the photopigment melanopsin and transmit signals through the retinohypothalamic tract. The importance of this pathway is altering the timing of circadian rhythms is illustrated by the observation that a person who travels across several time zones may experience jet lag, but his or her circadian clock is eventually synchronized with local day-night time. Attention, this is selectiveness of physical processes or any kind of mental activity, which helps in getting and processing the information. There are sensory, motor, intellectual, and emotional forms of attention, depending to kind of physical activity. There are voluntary and involuntary levels of attention. Involuntary attention is present from the birth of the human. Voluntary attention develops along the life due to mental activity, formation of speech function, and studying languages. According to Pavlov, it is possible to classify the behavior of the person depending on individual specialties of main nerve processes as capacity for induction, capacity for inhibition, capacity for excitation, the rate of spreading excitation or inhibition in the central nervous system, and capacity for changing between excitation and inhibition in the human central nervous system. And based on these specialties of the main nerve processes in the central nervous system, Pavlov classifies type of higher nervous activity according to several attributes that considered as most reliable indices of higher nervous activity. For instance, he described four main functional types of higher nervous activity based on the interrelation between main nerve processes. So they are the strong unbalanced type, characterized by predominance of excitation over inhibition, strong well-balanced active type, characterized by high mobility of nerve processes, strong well-balanced passive type, characterized by low mobility of the nerve processes, and weak type, characterized by extremely weak development of both excitation and inhibition, which cause fatigue and low work capacity. You actually can see examples of behavioral reaction of this different type of temperament of people to the crumpled head based on the comics by Bidstrup. And Pavlov also had described the other classification, which presented predomination of first or second signaling system, and based on that he revealed the type of personality with privation of first signaling system, which mainly tend to logical thinking, and type with privation of second signaling system, which better obtains information by analyzing image information. Then a set of external manifestations of human temperament was also analyzed by Hans Eysenck. On the basis of his clinical experience, Hans Eysenck was a psychiatrist and neurologist, and based on analyzing behavior of variable people who came to his hospital, he finally revealed some 3 personal parameters as extraversion or introversion, the neuroticism, and psychoticism. And based on different combination between the extra or introversion and neuroticism, he had described also some types of personality, which actually quite similar to classification which had been formulated by Ivan Petrovich Pavlov. Extroversive person, according to Hans Eysenck, is open-hearted, has high social activity, interested in public relation. On the other hand, introversive person is passive emotionally, unstable, and interested mainly in the inner experience. And it concerned peculiarities of reticulocortical interconnections lay in the basis of these personal features. Introversive temperament correlates with greater activity of septal and hippocampal inhibitory system in the brain, and a neurotic person is characterized by Hans Eysenck as highly irritable person and less adapted person for variable condition. And there was revealed in later studies that level of neuroticism correlates to activity of limbic and cortical interconnections in the brain. And psychotic person, according to Hans Eysenck, is highly egocentric, cool in interpersonal relations, and even aggressive. And importance of social medium in formation of personal temperament is very high. The personal features of temperament get brighter with age, and knowledge of specialties of temperament also helps to medical specialists to reveal evidence of development variable pathologies, because there is found variable correlations between the type of temperament and predisposition of people for some health problems. Then mental work actually is based in ability of people to develop conditional reflexes, and is based on ability to concentrate attention, consolidate memory traces, perform thinking process, control emotions, and so on. And in the basis of the mental work actually lays the mechanism of creation, the conditioned reflexes, and the concentration on a certain kind of mental activity may be actually explained by properties of the dominant center in the brain, described by Ukhtomsky, and which was discussed in previous lecture. The work of operator nowadays is very popular kind of the mental work, which includes the professionals which are required to control variable machines or mechanisms and to control some technological processes. This work gives a great load to attention. The tiny motions of arm require also a great load, and the static contraction of large muscles, especially of the back, may result in problem of back and trunk muscles. One more very popular kind of mental work today, this is work of official, which includes the leadership of variable enterprises, companies, hospitals. For this work, the person must process a great amount of information, in many cases in conditions of deficit of information, and to take quick and precise decision and optimal decision in mechanism of in condition of lack of time, which is highly responsible and which creates a great pressure to the mental activity, requires a deep and detailed knowledge, and also creates a high level of stress load to this person. Another kind of work is creative work, which is one of most complex form of human activity, like work of artists, scientists. And this work includes communication with different people, taking decisions with high responsibility, consolidation of variable kinds of information, and requires, besides theoretical knowledge and quick thinking, also requires empathy and the ethical relation to the subject of work. And so this creative work requires variable practical skills and also requires understanding of psychology and behavior of other people. The next kind of work, this is work of students, pupils. Actually, nowadays, majority of specialists, especially highly educated specialists, are required to study lifelong. So this may be typical also for work of the doctor and other kind of medical specialists, I mean. The passing exams and taking decisions, analyzing and memorizing of large volume of information also creates a great level of stress and requires a lot of activity of variable cortical areas, required ability to concentrate attention, and the mental work is most effective in a regular regimen of work and rest. The phenomena of dynamic stereotype was described since Pavlov as the optimal organizing of behavior for the best result of work, which means that the scheduling of work activity always help for the organism to be ready for beginning variable kinds of activity or different steps of the work process. This is perfectly true for organizing activity of the hospital and the scheduling of variable steps of the work of the doctor is also helpful for the patient condition, because patient always knows what's going on, when will be the examining, when will be the attending by relatives, when will be eating when will be variable passages and so on. And usually it is highly recommended to create in the hospital some cyclic schedule which repeats every day, which helps both for the doctors for their better activity and for the patients, and minimizes helps to minimize the patient's stress. For performing mental work, it is very important the autonomic and emotional reactions which provide activation of attention, memory. Also, all these functions require usually high level of activity of the sympathetic nervous system and adrenaline production, which helps to supply the central nervous system with metabolic resources on one hand. On the other hand, it creates the great load to the other organs and system, for instance, to circulatory system. And because of that, nowadays, there is a recommendation to terminate the mental activity and physical activity, and actually increase parallel both kinds of activity, because it is not very good when a person performs a long-lasting mental work without any motion. It creates chronic stress and helps for development of variable pathologies. Then, keeping of high mental work capacity requires autonomic control of metabolic supply in the brain, which is necessary for proper excitability of the nerve cells. Main functional mechanisms which explain mental work is producing dominant center in the brain, and also during mental activity, the more complex task is solved, the greater quantities of brain centers get synchronized in their electrical activity. For performing mental work, the autonomic and emotional reactions provide activation of attention, memory, and actually emotions help to concentrate attention, because without personal interest to the subject of mental work, it's quite a problematic task to keep the concentrated attention for a long time. The physical exercises is the kind of activity associated with very extensive alterations in the circulatory and respiratory system. If some of these extremes of exercise were continued for even moderately prolonged period, it may act as stressor. Main systems which help to keep high level of physical activity are phosphocreatine creatine system, the glycogen lactic acid system, and aerobic oxidation system. And in addition to large usage of carbohydrates by muscles during exercise, especially during early stage of exercise, muscles use large amount of fat for energy in the form of fatty acids and acetocatic acid. They use also to a much less extent proteins in the form of amino acids. Ability to training depends on genetic peculiarities of the organism, but the process of training really can improve their physical work capacity because of mechanism of adaptation. Activation of sympathetic nervous system and adrenal glands actually provide the appropriate regulatory influences which are revealed in the beginning of the muscular contractions and along the time of physical work performance. The main kinds of the work activity may be characterized as hard physical load, which is not mechanized work, the mechanized or partially mechanized work, and work on conveyor, which requires also synchronizing of work in people group, produce monotone lead, and so increases pressure to central nervous system. According to stages of the process of physical exercises, may be described the condition before starting exercise, the period of rising work capacity, and then period of tiredness. Condition before starting exercises also described in literature as pre-start condition. Before starting well-known exercises or well-known physical activity, the appropriate regulatory systems get activated, and this always causes rising of the blood pressure, the respiratory rate, the oxygen consumption by muscles, and this is possible due to activation of sympathetic nervous system, and this mechanism is acting due to variable conditioned reflexes. The period of rising work capacity include the intensive contraction of skeletal muscles, intensive locomotion, which rises quite quickly after 4 to 5 seconds, and after 20 to 30 seconds, due to somatovisceral reflexes stimulation, will be increased the respiratory rate, intensity of breathing, the intensity of circulation also, the heartbeat rate rises, and rising of stroke volume provides the proper intensity of blood supply already after 3 to 5 minutes since beginning of physical activity. The time of development of high work capacity during exercises depends on the previous training and how is usual this kind of physical activity for the person. The period of high work capacity is possible due to variable biochemical mechanisms acting in contracting muscles, which you have studied in the biochemistry course, and the greater physical load, the shorter time of the high work capacity reveal. The tiredness after exercises develops because of variable reasons. The metabolic exhaustion first begins in muscles when the store of metabolic resources like glucose get exhausted. But if despite that the person continues activity, then the nerve centers may be exhausted with the amount of neurotransmitters in them, and the exhaustion of the very highest levels of control of muscular contraction are life dangerous because they may result in severe dysregulation of the thalamic and hypothalamic centers in the central nervous system, and severe disturbances in the level of the blood pressure. There are actually preconditions for recovery after exercises. The two effects of tiredness are, first of all, increased wakability due to training, and also severe chronic tiredness that lead to functional disorders and disease in case of overloading of all organs and systems. The result depends on the correspondence between exhaustion of functional reserves of the organism and activity of recovery processes.